Hey everybody, thanks for joining me today. Dr. Ross Marcagiani with another great word of the week. Today's word of the week is going to be volatile organic compounds, VOCs. So we'll be talking about what volatile organic compounds are, how they affect our body, and how we reduce VOCs. Let's dive in. So we wanted to make sure we brought some awareness to VOCs because we recognize here at Turnpaugh and Wellness Center how impactful they are to the health and to our overall well-being. So we wanted to bring some awareness to VOCs. So what are volatile organic compounds? Well, as the name describes, they are harmful compounds that are gases that are emitted from liquids in solids that can cause short-term and or long-term effects in our health. You can see here over on the side the long laundry list of volatile organic compounds, what they are typically off-gassed from in the air. And we can either breathe these in, typically from off-gassing, or they can be absorbed through our skin. So we can, get these pretty easily. And again, you can see the long laundry list here, whether it be paint strippers, cleaning supplies, makeup, cosmetics, cleaners, and much more that are in our world and exposed to us. So it's almost impossible to get away from these VOCs 100%. Now we need to make sure that we're doing everything else in our power to reduce our exposure and our intake of VOCs. So I just want to bring awareness to that. It's going to be almost impossible to completely avoid this, but we want to bring awareness to this. So what are your more common types of gases that will be emitted from these various products? We can see we have acetone. Now, I'm going to give you, I don't know, I forget off the top of my head what exactly each one is, but obviously in regards to where it's connected to in our life, but obviously acetone for like nail polish removal. You can also find it in furniture polish and wallpaper. You have butanol. Butanol is found in like stoves, cigarettes, barbecues. Carbon disulfide is typically in chlorinated tap water. Dichlorobenzenes are mothballs, deodorizers, where you can find this. Your ethanol, obviously related to alcohol. This is going to be like your glass cleaners, your dishwasher detergent, and laundry detergents. Your formaldehyde, mainly in your molded plastics. Is that what's going to off-gas? Your terpenes are in your soap detergents and laundry detergents. And then your toluene, mainly found in paint. And your xylene, mainly found in the off-gassing or emission of gas or from vehicles, right? Idling cars, traffic emissions. And it was found that VOCs can be 2 to 5 times higher inside compared to outside. So they're much higher inside the home. So that being said, how can they affect our body? So in acute exposure, we can get irritation of the eye, nose, throat, and skin. We can have headaches. We can have nausea, vomiting, vertigo, which is dizziness, and result in acute and chronic asthma. In the more chronic side, long-term exposure of these VOCs, it can create various types of cancer. It can damage the liver, damage the kidneys, cause for central nervous system disorders, can lead to immune dysfunction or autoimmune conditions, can cause people to have what's called or contribute to multiple chemical sensitivity. They can cause chronic inflammation, increased risk to cardiovascular disease. In the video that I'm going to mention here in just a moment, they actually did a study of patients who were exposed to a higher percent of VOCs and had an increased risk to CRP, C-reactive protein, which is a marker of inflammation and can affect our cardiovascular system, our respiratory system. And we know from viewing my videos how much inflammation can affect our body. So how do we reduce these VOCs? So we want to make sure if we have any solvents, lacquers, paints, any caulking, either throw them out once you're done with them or make sure they're not stored in the house. Store them either in the garage if it's detached or if you have a shed or something like that, store them there. Replace your cleaning products or other detergents or solvents. Go to Environmental Working Group, EWG. They have a really good app that I use a lot of time for all my cleaning products and detergent products that give you a rating on the safety and the chemical exposure and the VOCs of it. So really, really helpful to make sure you know you're using clean products on your body and in your environment here. Consider looking at low VOC paints and furnishings. Make sure we have good ventilation and climate control. Keep the windows open. Have fans going through. Don't keep the house always closed down and letting those VOCs build up. Look in your basement. Get a radon test done. Not necessarily a VOC, but want to make sure you know where that level is at. Really interesting video that I just watched. It was about an hour long. Not the most entertaining and exciting, but let me just reference here. The two speakers are both tightly regulated to the EPA, Terry Brennan and Lou Harriman. Long list of credentials and their connection with the EPA, making sure that they're giving their best advice. And through the video, they talked about using getting a good filter for your HVAC, a MERV rating of 13 or higher, which again you can just Google that, but basically is a high effective or high efficiency rate for a filtration unit. Also, if you want to add in addition to that, portable cleaners, which a high CADR rate, which is a clean air delivery rate. I put the website here. If you go to that website, it gives you a plethora of portable cleaners and actually in-home ventilation systems that are really, really helpful in lowering your VOCs. And then we want to talk about making sure we're improving detox pathways. I know people have heard about me talking about detoxification and listened to our videos. Going back to the basics. Making sure we're having good nutrition, making sure we're having a high antioxidant-rich diet, lots of veggies, lots of colorful fruits, color of the rainbow plate, right? We want to make sure we're improving detoxification, using glutathione, whether it be orally or getting an IV. For me, myself, I do at least 400, sometimes titrate up to 800 milligrams a day of glutathione. Using binders or activated charcoal or bentonite clay to remove these toxins that are circulating in the body. Using good sulfur amino acids to help push phase 2 of detoxification. Using good B vitamins and sulfur amino acids B vitamins to push phase 1 of detoxification. Using chlorella. Using diindolylmethane, DIM, using citrus pectin to help improve kidney function. Glutathione is going to help improve kidney function. So making sure you're assessing your detoxification pathways, making sure you are getting blood work done and you're getting proper assessment, how well you're detoxifying, how well you're removing these VOCs, because we're not going to be able to remove them completely. We're not going to be able to avoid them completely, and just making sure your body is healthy. I hope you enjoyed this video. If you know anyone that can benefit from this, please share this video. VOCs is something that we should be aware of and that we want to at least have some knowledge in regards to. I hope you enjoyed this video. Have a great day.